Hey friends, I'm Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So welcome to the Dr. Molly Says podcast. Hello, do you see where we are? So here's the deal. Real life, I'm a working, very busy mom, and we are in my kids' playroom, because this week has been insane. I already recorded this once. I had technical difficulties, so I'm re-recording, and my kids are home. My in-laws are in town, and so I am in the playroom recording this. So welcome to mom life. We are going to do another breed episode today, and Cooper's here if you haven't noticed. I just gave him his wolf popsicle, so that should keep him occupied the whole time we're chatting. But Cooper is here. Hopefully you can see him. You might can hear him. Here, I'll let you hear his wolf popsicle. Ready? He says hi, because we're going to do an episode on the Labrador Retriever, which is what Cooper is, my dog, and one of my very favorite breeds in the whole wide world. So we're going to do a breed episode on labs. But before we start talking about that, we can call this the hot take if we want. But I just wanted to kind of talk about a couple things that there's a lot of chatter about on the internet right now. And I've talked about this, which is vaccines, a good bit on the podcast. And I realize that most of the people listening to this, you are someone who believes in science and trusts experts and doctors and professionals. And so I know I'm preaching to the choir a little bit, but I made a post about the rabies vaccine this week. And there's just a lot of talk about vaccines and our pets around on the internet right now. There's a lot of misinformation going around. And based on the comment section of, like, for example, my post about rabies, I can see as a human being that there are a lot of people who are, one, very confused or misinformed about what vaccines even are, what they do, why they're needed, especially for our animal pets, for diseases like rabies, like leptospirosis. And so anyway, I've talked about vaccines, but I just wanted to sort of talk a little bit more in depth about a couple of things in the realm of vaccines. So the first thing I want to talk about is there's a new MRNA technology rabies vaccine on the market. I know that it's being distributed in Canada. It's available to be on the market in the US. I don't know that it's being distributed yet. I don't know of any practices that have it yet, but there is some misinformation being spread and hysteria about this new rabies vaccine on the internet. Some of that is coming from a veterinarian, which is very sad. Her name is Dr. Judy Morgan. She has been known for a long time to be sort of a grifter in the veterinary space. She calls herself a holistic veterinarian. And I personally love integrative medicine. I think there are different schools of thought on a lot of things, and I think integrating them is a great idea. What she's doing, though, is not that. She does a lot of fear mongering. She posts a lot of misinformation. She cherry picks information about different subjects to make you think something sounds really bad and scary. And then, not coincidentally, she sells a lot of products. So she sells her own natural flea and tick preventions, heartworm things. She sells courses on how to treat your pets holistically. And so, I think there's definitely a concern for a conflict of interest there. So if that's who you're listening to and worried about this, just know that the vast majority of the veterinary community does not agree with her, and what she says does not follow science and real evidence. So let's talk about this new vaccine. So mRNA technology is very interesting. It's a newer vaccine technology. It's not brand new, but the type that's being used for this specific rabies vaccine is actually very, very cool. And I've had people comment on my post about it, and they clearly do not understand how it or really any vaccines work. So I want to explain what the difference is. So with a traditional rabies vaccine, what happens to create that vaccine is rabies virus is isolated and killed. So it's inactivated so that it cannot cause rabies in a patient. And that killed virus, what it does when the patient is injected with that vaccine, it shows itself to the immune system so that the immune system can create antibodies to fight off rabies if the patient were to be exposed to it and prevent the progression to neurologic disease that we know is pretty much 100% fatal. So that's what the traditional rabies killed vaccine is. That requires different ingredients to help amplify that immune response, like adjuvants. Adjuvants are something that are necessary for a lot of vaccines to work well. They are the reason, or one of the reasons, we think that some patients can have reactions to vaccines, whether that be like a very mild local site reaction, like a little bit of swelling, or worst case, very, very rare case, anaphylactic reaction. Adjuvants are one ingredient that are necessary but linked to some of the rare but possible reactions to vaccines. So what's interesting about this new mRNA technology for this new rabies vaccine is that it removes the need for adjuvants. And the irony of the people who are freaking out about this vaccine are the same people who don't like adjuvant in other vaccines because of the connection to reactions. The other interesting and ironic thing is that there is a lot of hope that this type of vaccine can last consistently and provide protection for longer than the 3 years, which is what the killed rabies vaccine we have labeling for. And so that has not been proven. It is not a label yet, but there are a lot of people in the scientific community hoping that this new mRNA technology allows for longer rabies vaccine protection, which would mean patients would need to be vaccinated less often, which is what I thought these people wanted. But this is just more evidence that we're just listening to people who are fear-mongering and creating unnecessary hysteria. So here is exactly how the mRNA vaccine works, okay? So what happens is it's an RNA particle vaccine. So these RNA particles, they're tiny, they're very short-lived in the body. Those are what are included in the vaccine, and they don't need adjuvants. Here's why. So when that vaccine is given, those tiny RNA particles basically have instructions for dendritic cells, which are part of the immune system. So that the dendritic cells are who are going to see that RNA first when the vaccine is given. These are like messenger cells for the immune system. So the dendritic cells read the instruction manual from the RNA particles, and what it tells the dendritic cells how to do is create surface glycoprotein, which is a piece of the rabies virus, okay? So it's a harmless piece of the rabies virus, and the RNA tells dendritic cells basically how to make it. So then those dendritic cells can make this glycoprotein, and because the RNA is self-amplifying in the cells, that allows for a lot of that glycoprotein to be made. And so that's why that this vaccine does not need an adjuvant, okay? Once the dendritic cells know how to make that glycoprotein, and they do, those cells then show that glycoprotein to the rest of the immune system, which allows for the immune system to create those antibodies against rabies. And so we reach the same goal with the vaccine, but it's doing it in a different way. The RNA particles, they break down and they disappear from the body very quickly. There are people that in my comments saying that the mRNA vaccines change the DNA of the patient and start amplifying in the organs. I don't know where that comes from, but that is not what's happening. The RNA particles do not enter the nucleus of those cells, and so they do not affect DNA in any way. So that just is simply not true. It's not what happens. So yeah, that's how the new mRNA vaccine works. And hopefully that helps people understand why something different was created. Someone else was like, why are they making a new kind? Well, partly because of the same reasons these same people have complaints. They don't want to vaccinate their pets more often than they need to. And titers can be expensive, and titers are not legally recognized for rabies. And so if this new product that's coming to market can be labeled for longer than 3 years, that should be a good thing. So anyway, just to clear that up, if you've seen any posts about the new mRNA rabies vaccine, this is not like a secret mission by Big Pharma to sneak this vaccine into your clinics. Vet clinics can carry whatever rabies vaccine they want, and this is not the only one. But to me, it sounds very, very cool, and I'm very hopeful about what this could mean in the long term for rabies protection for our patients. So anyway, then a couple other just quick things about vaccines. Someone today commented that they know that the rabies vaccine works in the patient's brain. Where are people getting these ideas? No, it works in the immune system on a cellular level. The lymph nodes are involved as far as like organs go. The other thing people constantly are complaining about with vaccines is the dose of vaccine. So one very common complaint within the anti-pet vaccine crowd is that we give the same volume of vaccine to a Chihuahua as we do a Great Dane. And the answer is yes. Yes, we do, because that's what we should do, because vaccines are not drugs. They're not medications, and the volume of the vaccine has nothing to do with the weight of the pet. It just is enough of whatever ingredient in the vaccine is causing the immune system to create antibodies. It's just however much of that is needed to cause that reaction. Or that immune stimulation. So the other thing about the new mRNA vaccine is that it is a 0.5 ml volume vaccine. So these same people complaining about giving the same volume to all the patients, this is half the volume of a traditional rabies vaccine, which, mind you, a traditional rabies vaccine is 1 milliliter. Okay. That is less than a teaspoon of liquid, but this new mRNA version is a 0.5 of a milliliter. So it's half the volume of the traditional rabies vaccine. So again, I don't really know why these people are so upset about this, but that volume of vaccine is just a dose for a dog and a cat. It has nothing to do with weight. That's not how vaccines work. It's the same. It would be the logic of a little dog needs a smaller vaccine is the same logic that doesn't make sense of a bigger dog would need to be exposed more to a virus to get sick. Like that doesn't make sense, right? We just get exposed to a virus and we get sick no matter how big we are. So it's the same with the vaccine because it's not a medication. It's a vaccine. Okay. I hope that clears some things up. Also, last thing, rabies laws are different in every state, sometimes different within the state. Veterinarians have to follow those laws. Some states only require rabies every 3 years after a patient has had their puppy rabies and then a booster a year later. A lot of states are that way. So this is another thing. I get frustrated sometimes because I do think some veterinarians have created more of an obstacle here by continuing to vaccinate for rabies and distemper parvo every single year when they don't need to. And I think some of that is just people stuck in their ways. But if you're going to a vet clinic where they're saying you have to vaccinate for distemper parvo and rabies every year, and that annual rabies is not required in your state, you do not have to do that, but you do need to go to a clinic that will create your vaccine reminders to reflect the 3-year requirement. I hope that makes sense. So again, not all veterinary medicine is created equally. Some veterinarians are doing things that make life harder for the rest of us, and that is one of those things. So the more you know. Okay, let's talk about something more fun. We're going to do the Labrador Retriever. So I'm a little bit biased because I have always had Labrador Retrievers. So growing up, my parents had labs. My dad is a duck hunter. I grew up duck hunting with my dad. And he has always had Labrador Retrievers. That started because he used them for duck hunting, but he fell in love with the breed at a young age. And so we had multiple labs my whole life. My I've had a lot of labs in my life. It's like making me emotional because they're just wonderful dogs. So, Sandy was my like childhood heart dog. He was a yellow lab who my dad rescued. My dad was duck hunting and he went back. He didn't have a dog at the time. We had actually recently lost a dog. Our lab had died. So we didn't have a dog at the time. And my dad was hunting. And when he got done hunting, he went back to his truck. And laying next to his truck was this emaciated, big framed yellow lab who was in bad shape. He could see that he had clearly been shot with a shotgun probably multiple times. He had just like buckshot wounds everywhere. And he was just laying next to my dad's truck like, let's go home. And so my dad kind of like, I think drove around, is anybody looking for a dog? Loaded him up in the truck. This was, in the 90s, mind you. So there were no like Facebook groups about lost dogs. So he loaded the dog up, came home with him. It's very weird. I remember weird things about my childhood. I had like a premonition about this. So I was a kid and I was wanting a new dog. Of course, I always wanted to have animals around. We always had cats, but we didn't have a dog at the time. And I like knew that my dad was going to bring home a dog. It's the weirdest thing. Sure enough, he shows up in the late afternoon, comes home, and this big, skinny, sweet yellow lab jumps out of the truck. So he was like a young dog, I don't know, 1 or 2 at the time, and we named him Sandy. And he lived until he was like 12 or 13, I think, and he just grew up, had the best life in our house with me and my sisters. And he was not a duck hunting dog. He was gun shy, probably because of his past. And he just was the best dog ever. So anyway, I had Sandy growing up. Other labs were in our house. My great grandfather had a lab, an old grouchy lab. In hindsight, he probably had osteoarthritis, but his name was Pepsi. And he was this black lab with a white face. And he was kind of grumpy, but he and I just got along really well, and he was not grumpy with me. My great granddad passed away and Pepsi was still alive. So Pepsi came to live with us until he passed away. And he was also a special lab to be in my childhood. So anyway, I've had labs for a long time. Ryan and I got a lab. Here he is, Cooper, for our first anniversary. And so Cooper is 11 now. It'll be 12 in the spring. And Cooper's been our dog through a lot of life, a lot of hard things, a lot of happy things. And he's our kid's dog. And we're just super thankful for him. So excited to talk about his breed. Labrador Retrievers are very popular in the U.S. and in other countries. They have been named America's favorite dog in the past. We might also argue they could be America's favorite chaos generator because they're funny dogs. They can be a lot to handle. They can have a lot of energy and they can be destructive. So we want to talk about the good, the bad, and the ugly, right? But we'll start with the good. So Labrador Retrievers the breed originated in Newfoundland. They were originally bred for fishermen to be in fishing boats, helping to haul nets, retrieve fish, and be able to work long hours in the cold and wet. So because of their original purpose, they really are working retrievers. So they have a lot of energy, a lot of stamina. If they're in shape, they're eager to please. They have high drive to retrieve and do things for their people. And they can be very trainable. Can be. In general, lab personalities are so fun. They are usually friendly. They're people focused. So a lot of labs, they want to please their people. They're very enthusiastic. They can have a lot of personality. They can make great family dogs. They are usually eager to please, which makes them easy to train, like I said. And they are also very food driven. We're going to talk about the science of that in a minute. Labs are extremely food driven, which can help with training. I think this is part of the reason why they are so trainable, because like you offer a lab a sniff of a treat, they will walk on water, whatever you want them to do. But this can also cause risk of obesity. So something we're definitely going to talk about today. They do have a need for physical and mental activity because they do have so much energy and they want to do something. So labs they can be extremely cuddly. They are happy to go run with you, play with you, hunt with you, work for you. And then a lot of them are also happy to lay on the couch with you. Cooper, he's getting winded going after this popsicle. Cooper was a super textbook Labrador Retriever as a puppy. So cute, so high energy, loved us immediately, very eager to please us, wanted to be with us. He was insane, like crazy high energy lab. He did start to calm down around the age of 2. So when people get lab puppies, especially for the first time, I tell them around the age of 2 to 3, they're either going to calm down or they're going to be crazy for a long, long time. Cooper definitely mellowed out between 2 and 3. And so as a more adult dog, he is pretty chill. He loves to fetch and play outside, and he does love food. He's very food motivated. Something else that can be a concern with labs is they can be destructive. So they will definitely eat your shoes because of all the things, but I think being food driven is a thing. They just will eat things. Cooper has counter surfed. He's eaten raw meat off the counter. One time when he was like 4 years old, I'll never forget. I was actually at my in-laws who are here right now, and we were making pork chops, I think, and I like picked a pork chop off the counter raw to like move it to the pan, and in transit, Cooper like had the whole pork chop in his mouth mid-transit. So anyway, yeah, they can be very destructive. And so a lot of labs do really well being crate trained. I mean, I think all dogs do, but it's really important with lab puppies to train them early, get them used to being in a crate, get them comfortable being in a crate. You cannot trust them. Do not trust a lab puppy, especially. They will destroy things in your house. They will eat things in your house. They will get obstructed and have to have foreign body surgery. So these are very important things to be aware of. They also have a coat that sheds a lot. So Cooper's hair is all over my house constantly, all over my clothes, all over my shoes, all over our furniture, all over the floor. We are constantly sweeping and vacuuming up hair. So they are not a low maintenance dog in that regard. They can shed their undercoat a lot, so they'll blow out like this fluffy coat a couple times a year. Cooper definitely does that, and then the shedding is worse. So that's another thing to know that you're signing up for if you get a lab. There is we now have science that tells us why labs are so food driven. So we know that a lot of lines of Labrador Retrievers have a POMC gene mutation, which this mutation reduces satiety signaling, meaning these dogs feel hungry all the time. It's really hard to make them feel full. And we definitely see this. I think Cooper probably has this gene mutation. Absolutely, he does. When Cooper was a puppy, story time, there's going to be a lot of story times in this episode. He broke into a cat food bin. We had a cat when I was in vet school, and Charlotte. And Cooper, as like a, 3 or 4 month old puppy, got into the bin of cat food. He probably ate literally like 3 pounds of cat food. While I was at school, he had broken out of his crate, I think, and got it. So I get home, I open the door, and I immediately know, like, something has happened here. It reeks of dog poop. And there is just like a trail of puppy diarrhea all the way back to my bedroom. And there's Cooper, this cute little black lab laid out on my bed. There's diarrhea all over the bed. He's on his back, and he's just like struggling to breathe because he's so full of cat food. So anyway, he had like food bloat from eating cat food. So I had to take him to the clinic, the vet hospital. I was in vet school, and he had to get IV fluids. We had to help him feel more comfortable while he passed some of that food. And wouldn't you know, the next day I left the cat bin open for a second, and he was like in there trying to eat it. So they don't learn. They don't care. They will literally eat themselves to death if you let them. I do have clients, dog owners, tell me sometimes like, oh, I keep feeding my dog because they just seem hungry all the time. Well, yes, they will. So don't do that. But because of this and just the way they are, labs are very prone to obesity. Labs are also very prone to some orthopedic issues. And so this is a bad combination. So if you have a lab, if you get a lab, if you're going to get a lab, it is very important. I would say the most important thing you could possibly do for your Labrador Retriever is be very diligent about keeping them at a healthy weight and body condition score with good muscle mass. This will support their musculoskeletal system. This will keep them alive longer. Science tells us that. And I see it day in and day out. It is actually pretty rare that I see a lab who is at a good, acceptable body condition score. Cooper, we've done a good job of that, I would say, over his life. There's definitely been a few moments where I can tell, like, okay, we bumped up a body condition score. We got to get this back in check. Some of that has a direct correlation to small human children, but it's something that you should be always thinking about if you have a Labrador Retriever and other breeds, but labs especially, and you should be talking to your vet about it. What's their body condition score? What should we weigh? How much should we be feeding to get to that weight, et cetera, et cetera. So obesity is a big problem. Let's talk about the orthopedic disease that we know labs are prone to. Hip dysplasia, elbow dysplasia. These are two developmental abnormalities that can cause big issues. They can cause degenerative joint disease and pain. And this is often a reason that we end up euthanizing older labs because they just get in debilitating pain from arthritis secondary to these issues, and we just can't control the pain anymore. So there are a lot of factors that go into this. Genetics is a very, very big one. These dogs grow fast, they get big, and they just have this predisposition from their genetics. And so we want to do everything we can to mitigate that. Keeping them at a good weight is the most important thing you can do, but there are other things. So we'll talk about the other things in a minute. I just want to kind of get through this list of things that we deal with. Labs also, we do see a good bit of labs with some skin issues. They can get ear infections because of their ear anatomy, and a lot of labs are swimming a lot, and swimming can cause ear infections. They also can have allergies. Environmental allergies are definitely an issue in these dogs. Not as much as other breeds, but it's definitely an issue we see fairly commonly in labs. There are some more rare genetic conditions that labs can have. These are things, again, that can be prevented with good genetic testing and breeding. So exercise-induced collapse is one. This is an autosomal recessive mutation. So this is a genetic problem, and they can get sudden weakness when they're stressed or excited. Labs are known to have a predisposition or genetic component for progressive retinal atrophy. This is degenerative eye disease. And then there is this even more rare issue called centronuclear myopathy that young dogs can have because of their genetics. So those are kind of three more rare things to know about. That's a relevant thing when we talk about picking a breeder, picking a lab if you're going to buy from a breeder. Labs, like I said, lots of energy. They need daily exercise, high energy exercise. It's really, really good for them to have mental work. A lot of dogs are labs are very scent motivated dog. So scent games can be really good for these dogs. Early training, activity, puzzle feeders, enrichment toys like the Pupsicle are really, really good for these dogs. Some labs, I think more than others, if they're bored, so if they're expected to just be a dog who sits around all day, I think that definitely leads to more destructive behaviors and foreign bodies and surgery. So something to know if you're thinking about getting one of these dogs. When we talk about the actual breed and genetics, there are 3 colors when it comes to breed clubs and what are recognized in Labrador Retrievers, and that is yellow, black, and chocolate. Now, if you're listening to this or watching this and you're like, I have definitely seen labs that are other colors, let's talk about it. So different kennel clubs and Labrador Retriever clubs, associations, all the lab people, dog people, traditionally have established that yellow, black, and chocolate are the 3 colors. Now, in the last several years, 10 to 20 years, there have been some breeding practices to get different color variations. You may see red labs. These are yellow labs. They just have a darker yellow sort of reddish coat. But there is another trend called the silver lab. And this is a color dilution. So silver labs, you've probably seen them. They're gray labs. They often have like light gray, hazelish eyes. This is a color dilution. And when we talk about genetics in animals, color dilutions can be connected to a lot of issues and skin issues, hair loss, things like that. There is a lot of controversy about silver labs, and there's a lot of train of thought that those dogs are created by using Weimaraners and breeding with Weimaraners to create that color. This is a controversial topic when it comes to the lab world. There's some current controversy about the Labrador Retriever clubs and the AKC kind of covertly adding silver as an accepted color. This just has happened in the last couple of weeks. There was a lot of blowback about that decision, and it's my understanding as of this morning that decision has been reversed. So to be determined, but I agree with the people who do not want the silver lab trend to continue, because I see a lot of silver labs with a lot of issues. So I think that that's a mistake to make that an accepted thing. Yeah, that's all I'll say about that for now. So orthopedic issues are a real big thing in labs, and obesity, which are connected. So when we talk about labs, if you're going to buy a lab from a breeder, there's a lot of things that you're going to want to know about the breeder, look for in the breeder, and expect. And again, it should not, I say this about anyone who wants to buy a dog from a breeder, it should not be easy to buy a dog from. You should not be able to decide on a Monday, I want a Labrador Retriever puppy. And then on Tuesday or Wednesday or Thursday or Friday, or even within the next month, to go to somewhere and bring a puppy home. That just rarely means that you've purchased a dog from a responsible, ethical breeder. So it should not be easy to buy a Labrador Retriever puppy. And here's why. Because you want to find a breeder who is doing things very responsibly. They're ethical. They're trying to preserve the Labrador Retriever line and make it better. So they should be breeding very, very carefully. They should be breeding, a very few amount of dogs, litters a year. They should be doing a lot of genetic testing, a lot of temperament testing. They should be interviewing you. You should be interviewing them. They should have a very detailed contract. They should say that they will always take that dog back if something happens and you can't keep it. And they should be very transparent about all of those things. They should be pro-vet. They should be pro-vaccines. And again, they should be very transparent. So you should know everything you could possibly know about both parents. You should see them. You should see the facility where they're coming from. You should see how they're being taken care of. You should know everything that is happening with that dog. And if you actually go by all of these guidelines I'm telling you about, it will be hard to find a Labrador Retriever puppy, period. Okay? So health testing that should happen for labs before they're ever bred, considered for breeding. So both parents should have testing, either OFA or pin hip, of their hips and elbows. They should have CAER eye exams. They should also have genetic testing for those 3 diseases I told you about. So that should all happen. They should have clearance OFA testing. Those should all be good, excellent. I can't remember what all the words are, but there should be testing of all of those things to prove that the parents are free of these genetic issues that we know Labrador Retrievers have, so that they're not perpetuating that on to their puppies. And then if, God forbid, those puppies were to breed, the next generation of labs. That is the whole point of this. Again, you should be having lots of conversations with a breeder. They should be asking you a lot of questions. They should be wanting to know what your lifestyle is like, what it's going to be like with the dog. What are you using the dog for? Their puppies are going to be raised in their home. They're going to have early socialization. They're going to have lots of neurologic stimulation. They're not going to send a puppy home with you before 8 weeks of age. And if there are any issues with any kind of medical history with parents or other puppies from other litters, etc., they're going to tell you about that. They will have taken those puppies to a veterinarian before you ever see them. A veterinarian will examine those puppies. A veterinarian is who's going to be giving vaccines to those puppies, not a neopar in the breeder's fridge in their barn. Okay? Hear me now. All of those things should be happening. It should not be easy to get a puppy. Okay. That is a lot of what I wanted to tell you about labs. There's a couple more things. So labs, lifespan, I don't know the actual number. I don't know if it's fully established, but I would say on average from what I see, labs live about 10 years, but we definitely see them older in dogs that have been kept at a good body weight and taken care of. And so Cooper's 11, doing great. I definitely have seen labs live to 15, 16, even 17. My parents had a lab who just passed away in the last 5 years, and she was 17. She was a smaller lab. I think that helps with longevity. Something that a lot of people are talking about right now is timing of spay and neuter. Definitely wanted to cover this in these dogs. So labs are a breed that definitely fall in the category of this is a large or giant breed dog, large breed dog who is prone to orthopedic issues. And so I definitely have conversations with my clients with labs about waiting to spay and neuter them until older ages. I usually spay female labs a little bit younger than I neuter male labs because of mammary cancer risk, different things. But I definitely encourage people to wait, if they can responsibly, until at least a year of age in female labs to spay them. And in males, we're definitely waiting 2 years plus to neuter them. And I do think that can help with their long-term orthopedic health. Labs are a breed that we do see some cancers in as they age. Hemangiosarcoma, terrible cancer. We've talked about that here. Is definitely something we see in labs. So we see them come in with sudden hemoabdomens. They've got a tumor in their spleen or their liver that's ruptured and they're bleeding. And so they are a breed that I would highly consider doing cancer screening in, talk about imaging early on. And again, their being overweight is such a problem. It leads to issues with their joints. I would definitely get these dogs on joint supplements early on. Joint supplements are preventative. They work best as prevention. And so starting a lab on a just kind of general joint supplement at a young age, around 2, I think is really important. I would definitely have these dogs on a diet that's formulated for large breeds, especially as a puppy while they're growing for the first couple of years of their life. And, high quality nutrition is important for all dogs, but these dogs included. So anyway, I am biased, but I very much love Labrador Retrievers. I love to see them as patients. They're usually good patients. They may just be hyper, but they're usually not aggressive. They can be. I think a lot of that is attributed to them not having enough physical and mental activity. But overall, they really are a great breed of dog. They are easy to love and they're funny. And Cooper is just really a great dog. So anyway, I would love to know about your labs. If you have questions about labs or thoughts, any funny lab stories, feel free to send them to me. You can send them to me, Dr. Molly Says, or on the podcast Instagram, Dr. Molly Says Pod. And we will do another breed in a few weeks. Let me know if there's a specific breed you want to talk about. So if you're not subscribed, make sure you subscribe to the podcast on YouTube. If you're watching this, if you're not watching this, you can on YouTube. Make sure you're following us on Instagram, TikTok, and or Facebook. And I will see you next week on the Dr. Molly Says podcast.